there, Miss Imogen. My name is Angie. I'm going to be your nurse today. I'm going to be taking care of you. I just wanted to let you know I just received an order from the doctor for you to receive some Lasix or furosemide through your IV. So first things first, can you tell me your name and date of birth? All right, Aunt Imogen, date of birth 8/28/1959. Perfect, that matches what I got here. And allergies, I have that you're allergic to penicillin. Is that correct? That's what's also showing on my band. All right, so that's correct. Great, so I just wanted to give you a little bit of education on the medication you're going to be receiving. Have you ever received furosemide or Lasix is sometimes what people have heard of before? No? Okay. So what this medication will do, it looks like you have some fluid on your lungs. That's what we can hear when we listen to your lungs, and that's kind of probably what's been causing some of your shortness of breath. And so what this will do is it will help to pull that fluid off of your lungs. But when we pull it off, the way we do this is it kind of functions throughout your kidneys, and it will help pull the fluid by increasing your urine production. So that being said, you're probably gonna have to go pee quite a bit when we give you this medicine. It's very important that you do ask for help whenever you need to go to the bathroom. It can make you, your blood pressure drop a little bit, so you could get lightheaded, you could feel dizzy. We wanna make sure, you get up slowly. So, and anytime, with you in the hospital and everything, and your cables and everything, we would just feel a lot better if you would use your call light and ask for help when you need to go to the bathroom. So do you have any questions for me before I go gather supplies and get the medication from the Omnicell? All right, so no questions? Great, I will go grab that, and then I will be back so we can give you that medicine. Knock, knock. All right, I'm back, Miss Imogen. Supplies down here. Alright, I think I'm going to bring the bed up here really quickly just to make this a little bit easier for myself. Bring it up to a working height. Okay, and now we lower this. And we will set up our supplies here. So my order is called for 40 milligrams of Lasix IV push, and what I have available is 40 milligrams in 5 mLs. I looked up in a drug book to see the rate in which I can infuse this in your push. So it says to push 20 to 40 milligrams over 1 to 2 minutes. So we're doing 40 milligrams. I think it's safer to go at that 2-minute mark. Push it nice and slow. I do not need to dilute this. So I can just pull straight from the vial. Could have used a 5 or 10 ml syringe, but I went with a 5 ml syringe here. Okay, so making sure I have no air bubbles in here. Let me pull out my 5 mLs here. All right, so let me clean and make sure we got a working IV here. One mnemonic I really like to use is called USACD. And when I'm dealing with flushes and dealing with giving medications, so I unclamp, I swab. Obviously, I am checking patency of my IV, and I can administer, and this goes for flush and medication here. So this is just making sure I've got a nice working IV, which I do. I got great blood return. It pushes without difficulty. She kind of feels that, can taste a little bit. So we know we got a good working IV there. So I am now going to take my 5 mils, and I know math-wise that comes out to 2.5 mils per minute. Get it where you can see my mils here. So I am looking at the second hand on my clock. All right, and I'm going to just push this slowly. I'm going to push that first 2.5 mils over 1 minute, doing it gradually, not 2.5 mils at once and then waiting another minute, but pushing slowly to make sure she's getting all of that medicine. Again, Miss Imogene, you know, if you have any pain or burning when I'm pushing this, just let me know. We don't want that IV to go bad. If you have any ringing or anything in your ears, also let us know. This medication does have the risk of it's called ototoxicity, or it can cause some damage to our hearing if we're not careful. Very rare, but can happen. So if you were to have any ringing in your ears, it would be something to keep in mind. Again, you are going to be peeing a lot more. So if you do need to get up and go to the restroom, please use your call light so we can help you to the restroom. Also, another thing is it can, when we're pulling off that fluid, that will also lower your blood pressure a little bit. So that being said, when you stand up, you know, we want to stand up slowly. Could make you feel a little lightheaded whenever you stand. So please let us take you to the bathroom so you don't get faint or fall or anything like that, especially since you've never had this medication before. We want to make sure we know how you respond to it. So I am right at that 2-minute mark here. Can disconnect. And then with this second flush here, I do want to make sure that I push this at the same rate that I was the medication, because there's still medication in that J loop. So not that the whole 10 mils has to go at that same rate, but I want to do a good mil or two just to make sure I've completely got all of the medication out of the J loop and out of the catheter in the arm. And once we have that, and I know I have pushed that flush slowly, I'm not going to slam the rest of the flush, but I can go a little bit quicker than I was. And whenever I go back to my USACD, so I had my unclamp, swab, administer, then CD is clamp. So as I'm finishing up that flush, I want to clamp, and then I can disconnect, okay? And this just helps with pressure in that catheter, kind of help keep it patent. Also helps with the pressure activation on the device here at the end. All right, so let me raise the rail back up on your bed here. Feeling okay from having that? Get you lowered here. All right. Do want to make sure as I'm cleaning up my trash, you have your call light there with you, so you can call us if you have any questions at all. If you need to get up and go to the restroom, please let us know. All right. Thank you so much, Miss Imogene. If you need anything, please do not hesitate to ask. Home out here. All right. Thank you.